Welcome, everybody. Most of you know me, Hugh Carter. I'm Vice President of External Affairs for the Chamber. And this is what has typically been our Government and Community Affairs monthly luncheon that we pivoted into a Zoom call for, gosh, a year now. And, hopefully we'll have an update soon on when we can get back in person. It might be as early as next month. But at any rate, really glad to have everybody here today. We are going to be covering the community health improvement plans, specifically the anti-poverty portion of the plan. And I'm really glad to have Jill Jolicoeur with us today. Jill's the assistant administrator for Douglas County. And we've been working behind the scenes for a couple of years on this plan. So it's kind of fun that we're finally able to come out and introduce it to people and start working with a larger audience. Jill, can you remind me, you came to us, how long have you been in that position? And you came from Johnson County, right?
Yeah, it'll be 5 years in May, and I came from the Johnson County Budget Office.
Fantastic. And then Valerie Carson is going to be co-presenting here. And Valorie is our fairly new. She came in the middle of the pandemic to take over as our Director of Policy and Planning for the Lawrence Douglas County Health Department. And Valorie, you want to remind me your previous position?
I was the Community Planning Director at United Community Services of Johnson County. So both Jill and I are transplants.
Interesting. Well, great. You bring that perspective with you.
Well, and I would say that you're the magnet, apparently.
Right. As long as we're attracting the right people like you, that's what matters. So, and Valorie is actually joining us from the fairgrounds where she's helping coordinate a vaccine clinic today. So appreciate you doing this. With that, what we're going to do is Jill and Valorie will run through the anti-poverty plan, and then I'm going to spend 5-7 minutes and kind of connect at least one piece of that plan to the chamber and why it matters so much for us. And then we'll go to questions and answers. I think we're going to get through this in a decent time, so we may not need the 90 minutes, but I blocked it just in case. But just want to remind everybody, if you would, be sure you keep yourself on mute. And we're going to go through the presentation before we do questions. So if you want to jot them down, great. Or feel free to use the chat box so you don't forget the question. But I think that's probably the best way to ensure that people can at least see the whole presentation in the hour. And I think that'll do it. Jill, I'll turn it over to you.
And I think we're going to start with me. So again, no, that's okay. This is Valerie Carson, and the reason I'm going to be starting is because this is an opportunity for me to kind of provide a brief overview of an update on Douglas County's community health plan. So as principal, I'm considered principal staff for Douglas County's community health plan here at Lawrence Douglas County Public Health. And so this is an opportunity to kind of go over what that assessment and planning process looks like, and how it acts as a foundation for what Jill is going to talk about, which is one of the focus areas, which is now called anti-poverty. So if you could just advance the slide for me, I appreciate it. So we do a community health and assessment and improvement plan as part of our accreditation as a public health board. And these two pieces are considered part of the 10 essential public health services. Lawrence Douglas County Public Health is very much committed to partnering with others in the community to identify, assess, and address priority health issues and factors that are impacting residents' health. If you're familiar with the idea of social determinants of health, it will not surprise you that many, if not most, of the factors that drive our chronic health issues and inequities in health for some populations are actually created and maintained outside the public health system, for that matter, outside the health system overall. things like adequate and affordable housing, access to healthy foods and safe places for physical activity, opportunities for strong education and employment that can help someone have enough income to maintain and meet their household's regular basic needs. Many of these kinds of things are actually outside of the individual person's choices or behaviors, and instead are reflected in the policies, systems, and in the environments that they are around that then impact their ability to either be healthy or not. So in order to bring about a vision of in our community where all have the just opportunity to fully be healthy and have strong well-being, we do this community health assessment and plan. Next. So as you can see here, this is a visual representation of those 10 essential services. But why do we do that community health assessment and improvement plan? I just want to be thoughtful about something that's happened that's very recent, that's related to COVID. About 2 months ago, the National Center for Health Statistics reported that in the first 6 months of 2020, that the US life expectancy on average had dropped a full year. And from 78.8 years to 77.8 years. And 2/3 of that drop was directly related to excess deaths due to COVID and to the addition of increased drug overdoses. Now, while this is startling enough when you think about a full year in a 6-month time frame, what was more startling and honestly more painful in my opinion was the inequity of the loss of life expectancy by race and ethnicity in that same time frame. So while if you identified as non-Hispanic white, you actually lost 0.8 years in that 6-month time frame. But if you identified as Hispanic, you lost almost 2 full years of life expectancy. And if you were non-Hispanic Black, 2.7 years in that 6-month time frame. These kinds of inequities further reinforce our responsibility to address racism in our work to achieve fair and a just opportunity for all of our residents to be healthy. One of the ways that we do that in this process is first to assess the residents' current health status and their needs and their issues. And we want to do that in such a way that's both quantitative and qualitative so that we understand all kinds of different parts of our community and what their particular needs are and where they struggle. And then we use that information, that assessment, as a foundation on which to build a health improvement plan and to identify what should be the primary areas of focus, because what could have the greatest impact, especially in those areas of inequity, to improve health. And if we know those areas of focus, what goals would we want to achieve to improve health outcomes? What kind of strategies would we need to engage in? And then in order to put those strategies into place, what kinds of resources would we need? What partners would we need to bring to the table? And then what actions would need to be taken in order to establish, again, that community in which all have a fair and just opportunity to be healthy. Next. So you can see here that this assessment and planning process is really very much an iterative type of process, which means that it's always ongoing. You start at the top in that phase 1 with collecting and analyzing that data and then deciding where you need to focus. You move to that strategic planning where you put together what do we need to do and how do we need to do it and with whom. And then you start taking action, and at the same time you want to make sure that you're evaluating the impact of your action, because that evaluation then informs the next set of collecting and analyzing data so that you continually are looking to improve the health of the community by understanding where the needs are and what kinds of actions we need to take in order to make change. Next. So if you prefer the linear model, which some people do, versus the iterative one, you can kind of see here how when you're doing that assessment and planning, you need to bring together your partners. You need help them understand and frame that issue, develop those goals and objectives, identify and prioritize which strategies need to be done. Some things need to be done before other things can be done, and then create the action steps to get those done. And we want that to happen very much in ways that are sustainable over time. So often trying to marry those with existing types of efforts in the community that are related to that, in addition to really thinking about what are the policies, what are the systems, what are the environments that need to be modified in order to promote health and for people to have better outcomes. Next. So in the 2017 community health assessment that then led to the 2018 through 2023 CHIP that we're currently underneath, there were multiple, as you can see here on the left, there were multiple different issues, contributing factors, we would call them, that had kind of risen to the top. And once those were assessed and discussed and the data was looked at deeply, we identified 4 different contributing factors as primary. That to focus on behavioral health, to focus on access to healthy food and physical activity, affordable housing, and what was initially called poverty and jobs and is now called anti-poverty. We also looked at all of 4 of these through what was a lens of equity, one that we were very intentional about. How do we create health equity across multiple populations? Next. So what you can see here is here's what our ending focus areas ended up being. It was very important that in this framework, you think about housing, anti-poverty, behavioral health, and access to healthy foods. Those are all outside of the immediate public health system. And so we needed partners to come together with us and to act as conveners and to help move that, because they had other areas of influence, access to resource and partnerships and relationships that they could bring to the table and in order to move these different issue areas forward. So for example, with the safe and affordable housing, you had Lawrence Douglas County Housing Authority. With behavioral health, you had the county itself. You had access to healthy foods was Live Well Douglas County. And with the anti-poverty, you've had United Way and Douglas County working together with the support of the Human Services Coalition. Throughout all of these, though, is a lens of how do we create greater health equity and justice, because we know that different subpopulations in our community are differentially impacted by each of these different 4 areas. So next. So when we think about the fact that, as stated a little bit earlier, we know that this CHAW and CHIP, as we call them, with community health assessment and community health plan, that this is an iterative process. So in order to be able to, we need to do that ongoing evaluation. So on the Healthier Together website, we often will capture many of those, as you see them on the right, some of those goals that were identified by those different focus areas. And then we also are looking at what their current levels are and what the goals are, and making updates to those on a regular basis to see if we're moving towards the direction that we want to achieve in order to improve health outcomes. And if we're not, then we really need to be looking at what kind of actions or strategies are we engaging in that maybe aren't effective, or we don't have the right partners at the place, so we can make modifications to that and see if those numbers start to move and that ultimately they bring about better health outcomes. So move forward one more. As you can see, it's really, really important to bring a broad group of different kinds of partners to the table, because they have different levels of influence, different access to different resources, and honestly, they bring different perspectives that can be really valuable in being able to put together what would be an effective plan of action. And so you see here with the anti-poverty that at least at one point when I captured this information, I'm not sure if this is totally accurate anymore, but I would hope so. You see a very broad group of different sectors that support different components and strategies of the anti-poverty plan. Next. And so kind of in wrapping that up and so letting you know kind of what's ongoing and what's coming up next in order to provide hopefully somewhat of a foundation for Jill moving forward. As we have in this past year, actually prior to me coming, decided to create a health equity and justice focus area that is still under development and still being defined, but we know that it's critical. And I think some of those national health statistics about the differential loss of life based on different races fully undergirds why we need a focus area on health equity and justice. So we have the ongoing implementation going on right now and refinement. And we know that we are just on the cusp of doing another community health assessment here. Probably will begin at the end of this year and go into 2022 because we will, and 23, because our planning will then inform the next CHIP, which will be in 2024 and through 2029. So I can answer questions now, or we can wait till after Jill and I are both finished.
Thanks, Valerie. I think we will hold questions until Jill's done. I think Jill mentioned she'll be maybe 20 minutes, so we'll still have you for a bit.
Thank you.
Thanks.
Thanks, Valerie. Thanks, Hugh. Thanks to everybody that showed up today and for your interest in hearing more about this work. As Hugh mentioned, we've been working on this plan for over 2 years. It blossomed out of what is a group, if you're not familiar with the Human Services Coalition, it is a group, it's a multi-sector collaborative group of health and human services agencies that has been meeting since 2018. Started out as being a problem-solving group, trying to understand where there are gaps, where there's opportunities for some collective impact among the agencies, the safety net and emergency service agencies that the county and the United Way provide funding to better understand where there are opportunities for us all to team up and have collective impact. And one of the themes that kept coming up were just issues of poverty and how can we impact and influence the what is often in the community generational poverty, and how that is influenced by racism and discrimination. And we quickly, my former partner in the work at the Human Services Coalition with the United Way, Leah Roslin. Leah is going to be transitioning to the city of Lawrence here soon, which is great news for the city of Lawrence. But one of the things that we quickly identified in the Human Services Coalition was these are subject matter experts. These are people, passionate staff members and agency directors that are in the trenches, in the field every day, trying to work with individuals and families that are living on the margins. And so what better group to go to start some planning work and get some information about how can we dive deeper in terms of going to the subject matter experts, being folks with the lived experience that are experiencing poverty. And so we use the Human Services Coalition as the convening group to develop the anti-poverty plan. It took a couple years to do that work because there was a lot of shared learning that needed to happen. Hugh was there, Christina was there. I'm probably missing other folks in this group, but I know those two in particular were there every step of the way. And from start to finish, they were there, and I think that's why they're here today, and we all have a lot of shared ownership around this plan and pride, and want to see it move forward as much as possible. So this gives you a higher level snapshot of the planning process. Like I said, you know, it started with the CHIP in 2018. We did a lot of work around development of local needs, aspirations, barriers, understanding the equity framework in the fall of 2019. And you can see summer of 2019, that's when we changed the title from Poverty and Jobs once it was under the umbrella of the Human Services Coalition. We, over the winter and spring of 2020, we looked at a lot of evidence-based equity impacts and intervention strategies with the help of staff at the and some technicians at the health department and through their partnership with KU Med. And then over the summer of 2020, we did some more intervention studying, community input gathering priority issues definition, and the community impact, our input work was really some work that was led by folks like Rua Hasabala and Christina Gentry, and some other folks that helped us develop some focus groups to really make sure that we're intentional about having conversations with folks with lived experience. And the work that those focus groups did really was just a doubling down of some survey work that Christina and Rua and others had done. I think 2018 or even earlier 2019 that were tangential to and supportive to the Douglas County Health Department's health equity report. And that health equity report, if you haven't read it, that really was a call to action for our group. Because what that said was that there were disproportionate experiences for our Black and Native American, Indigenous, Alaska Native communities in Douglas County. And none of us were satisfied with that. And so that really was the call to action to develop a plan that was responsive to that. And we feel like we've done that with this plan. So you can see the rest of this on this. We got approval and we're in implementation already. This is a snapshot of all the active member organizations that have participated in the development of this plan and our different work groups. I won't read all those to you, but it's a lot of organizations, a lot of hardworking folks. I mentioned the Anti-Poverty Survey and some of the top ideas that came out from that survey work on how to address poverty, job training, access to junior college, and one of the things I want to share is, when we presented this plan to the county commission a couple of weeks ago, we realized junior college may not be the most up-to-date term to use, but this is what was indicated in the response. When we surveyed folks, this is what they said. They want access to higher learning opportunities. So we can take it at that. Explore ban the box and employer applications that don't ask about criminal records, and no interest loans to community members. And what you can read into that is that in my interpretation is people are experiencing significant barriers to thriving and surviving in this community because of whether it's a history of poor rentals, evictions, just access to childcare, access to transportation, some sort of a criminal history, you name it. Folks are experiencing barriers to surviving and ultimately thriving in the community. Some more information here from the Anti-Poverty Survey and changes that can help people living without enough money to meet their needs: affordable housing, healthcare, affordable childcare, flexible hours, mental health, opportunities to improve wages, again, affordable housing, increase the minimum wage, incentives for businesses to provide a living wage, attracting businesses that offer technology and professional jobs. And you've got to see some of these bubbles here of other opportunities that popped into comments here. A lot of things over and over again keep coming up. This was a great quote that we like to pull out, and I think it's very symbolic of a lot of the challenges that we have in this community and have been struggling with for a long time. And this is help people long-term instead of short-term. Offering a night to stay in a shelter is not a long-term plan. There's a lot of truth in that, but then what's hard for folks like all of us around this room, this virtual room, and in the community, and folks that sit in buildings like where I sit is, well, how do we solve this? What does work? What strategies can we look at in other communities that have worked? How can we craft a plan and develop some strategies that are workable in our community, or that we could at least experiment with? So I'm going to dive into the plan, and this is kind of a high level. We have a mini page document if you want to dig into the details of it, but we're really proud of that big plan. But I'll I'll hit the highlights of the overall the goal statement, which is foster an equitable Douglas County economy by implementing systems-based solutions to reduce local poverty and discrimination and to expand access to opportunities so all can participate, prosper, and reach their full potential. Our overall objective is by 2023, create policy, system, and environmental changes that result in an environment in which the percentage of BIPOC children living in poverty does not increase. That does not increase part may sound a little not very aspirational, but when you factor in the COVID-19 pandemic and some of the statistics that Valerie mentioned a few minutes ago, that's realistic. And if we can just maintain, we're doing pretty good. But you can see also here who are our priority populations. I mentioned BIPOC children living in poverty in our overall objective. And we really are trying to stay focused like a laser on this with the hope that if we can focus on these priority populations, in the end, we can improve the overall system of care for folks that are experiencing poverty in the community. But we do feel like that there is a need to emphasize on these priority populations in this initial strategic plan. So we've got some focus areas, but we also identified some cross-cutting areas, one of which is transportation. I don't think that's a surprise to a lot of folks, but there continue to be opportunities to partner in a from a multi-sector standpoint, and different focus areas of the community health plan and different efforts that are planning work that goes on in the community already around developing strategies to impact safe, affordable, and accessible transportation opportunities that address the barriers to driving poverty for low-income households. So we're going to be working to develop a multi-sector work group within the Human Services Coalition, partnering with our friends with the MPO and the Transit Department, hopefully. Just trying to do some more work around studying local needs, barriers, and opportunities, and some evidence-based practices. And then understanding what are those county-wide transportation priorities for the community, and that we can make sure that we're getting a better understanding of what's needed to get access to work, childcare, criminal justice proceedings, and access to basic needs. Those are identified here because that's what we heard from folks when we talked to them. Why is transportation so crucial to you? And it's kind of a no-brainer, but these are make or break things that folks need to have transportation to. The next cross-cutting area is a data dashboard. I don't know how many times over the 2 years that we did this work, we said, it'd be great to know this. It'd be great to have this information. Or, oh, we have that information. Okay, well, where is it at? How is it accessible? Where can I see it? And so the need to be more intentional and transparent in terms of a snapshot of what's happening here on a local level was identified. So we're going to look at, we're going to work with our friends at the health department who are already doing tremendous work around data collaboration, and have really established an infrastructure that supports the collection of common measures across the community, and allows us to disaggregate key data by race and ethnicity, and support the availability of it on a transparent and actionable format that can inform policy decisions and program decisions. So the 3 focus areas that were identified by the group over the course of several meetings, if we could focus our efforts, they were children and childcare, the decriminalization of poverty, and jobs. The first one is children and childcare. Rich Minder with the Success by 6 Coalition was the convener of this work, and he had a lot of stakeholders in this group. And I know I'm going to leave some folks out, but some that come to mind are our friends at Positive Bright Start, Childcare Aware, and I know I'm losing others, but we had a really great and passionate group of folks that developed this plan. You can see the overall objectives here related to largely the childcare workforce. How can we how can we increase the percentage of the child in the child care workforce who are BIPOC? If we're focusing on BIPOC children, we should also be working with to bolster the BIPOC providers that are in the community, in-home providers and facility-based. We also want to increase the number of BIPOC owned or managed childcare facilities. So entrepreneurship, economic development, small business development in homes and centers by 10%. And then also increase the percentage of childcare workforce who are BIPOC and are paid a living wage by 10%. That is a big, hairy, audacious goal. And that's one that I think a lot of folks in this room that have studied this issue, I know Hugh has spent a lot of time on this from an economic development standpoint, is, you know, the economics of this area, just, they're hard to make sense of. And if we really want to see some meaningful things happen in the community in this area, we're going to have to do more. We're going to have to develop some supplemental opportunities from public and private resources, because the economics just, they're not going to work anytime soon. We've got a lot of strategies here. A pilot project. This is one area, this first one here, I'm not going to read all these to you because y'all can read these and you're going to get the report. But I want to just stop for a little bit on this first one, because the minimum, or launching a pilot project for provide high quality and affordable early care and education. This is one that we're working on this right now. Some really exciting developments have happened really recently and this week around that through the City of Lawrence's strategic plan around economic development, and some changes that have been happening with USD 497 and some opportunities to utilize Kennedy Elementary School for a community-based early care resource center. So this plan was in the back of folks' minds when they started, and why we were brought to our stakeholders in this group that have developed this work were brought to the table to immediately be able to offer some opportunities for how we could move towards a conceptual pilot to do some of this work and experiment. So I'm really excited to see how that develops here in the coming weeks and months and years. But we looked at some programs, some aspirational models that are serving BIPOC children and families in a 2-generational approach was really one of the ways that we wanted to focus. And one of them is, some of you may have been invited to go on a tour. And if you want to go on a tour, we've got a couple coming up next week and the week after. But if you're familiar with Operation Breakthrough in Kansas City, Missouri, truly is a transformational 2-generational approach to interrupting cycles of poverty and really tremendous early care and early education for children 0 to 6 years old. And now they're partnering with the Kansas City, Missouri School District to make sure that they're intervening with older kids as well. So children and child care. One of our other overarching objectives, I mentioned this, the cost burden of care. Trying to make sure that we increase the percentage of BIPOC families with infants and toddlers that are paying less than 7% of their income for quality care, from 10%, which is where it is now, and by 2023 to increase the percentage of Douglas County employers offering paid parental leave by 10%. And I'll pause there for a second and just say that, you know, I fully expect as one of the largest as representing one of the largest employers in Douglas County, I think this is something that we're going to have to take very seriously. We're going to have to lead the way in a lot of ways. And I think these are the things that our elected officials and county administrator and myself are thinking about. And I hope that folks in this group and our other businesses and public sector organizations will consider joining us in leading the way here, because I think it could be very transformational for our community and be just another reason to work for our organizations and our businesses. I'm not going to read through all the cost burden of care strategies here, but one thing that I think that's an easy one, create a community fund to fill tuition gaps. I think that's things that folks in this group might already be thinking about. And if you're not, I would empower you to do that. Those are things that we can actionable today. There are organizations like Childcare Aware and Positive Bright Start that have some really dynamic partnerships and collaborations with area organizations right now. They need scholarship funds too. Yeah, I'm not going to read through all of these, but I think we've got a good plan here. The next focus area is decriminalization of poverty. The objective here, you can see the conveners were Hugh and I, and our objective is to reduce the incarceration of Black and American Indian Alaska Native residents. It is no secret that Douglas County we have some historical challenges with the disproportionate incarceration of Black and Indigenous community members in our jail. So why not have it be our objective? That's what we're driving towards. And we believe that the strategies that are set forward here will help put us on the path to better influence that. And, you know, this is an objective that our Criminal Justice Coordinating Council also shares. But, you know, when Valerie talks about those social determinants of health, you know, for our criminal justice partners, it's difficult for them to influence some of the things that at a community level we can influence as well. But we do need those criminal justice partners to influence this work as well. So our strategies, similar to the data dashboard, the cross-cutting data, we want to establish a uniform criminal justice reporting resource for law enforcement, context bookings, charging, dispositions by race, and other demographic indicators. The Journal World covered kind of the initial unveiling from the Sheriff's Office of our data dashboard. And if you haven't had a chance to see it, it's pretty exciting. I think there's a link on our CJCC hub via the website, the county's website. But this is a significant move towards making sure that we are being transparent, performance oriented in terms of what's happening today in our jail and our justice system, including things like who's on house arrest, and looking at things like who's in our jail, but who's there the longest, and what are the charges that are associated with it, and having some informed, some information to have informed discussions that could indicate that we have some opportunities to intervene in a meaningful way. The next strategy is to review and reform fines, fees, and driver's license revocations. This came up over and over again, particularly when you talk about driver's licenses. I mean, it's a no-brainer, folks. There's a lot of folks that have lost their driver's license, and if you do not have a driver's license, you're significantly challenged in terms of employment opportunities, getting your kids to school, basic needs met, and it's not easy to get your driver's license back. Through our partnerships with our lobbying firm, Little Government Relations, and some of the collaborative efforts with the chamber, we are trying to make sure we're monitoring state legislation, but we're also trying to understand where there is some discretion at a local level. And so we really haven't dug in there, but we also want to look at fines and fees. A lot of these fines and fees that we can be influenced on a local level are largely going to be through our municipal court. And taking a hard look at things like, how is our municipal court funded? Maybe what we see now is that it's funded through fines and fees. So that's a tough pill to swallow. But we need to dig into that. We need to talk about it and figure out if there's alternatives to fines and fees, and things like sliding scales, and alternative service models. The third is to expand holistic and no to low cost community resource navigation for BIPOC that is client-centered with a focus on advocacy and engagement, multi-sector organizations using legal and non-legal services to meet their needs. Some of you may have seen some recent news around Kansas Holistic Defenders as in relation to the conversations around a public defender's office for Douglas County. I think there's a lot of opportunity to partner with that organization and do some good. They're engaged in this work, and I'm excited for that. But I also think that we have some organizations that are already doing this kind of work, but maybe they need some additional support. And I'm thinking of organizations like the Indigenous Center, the Sunrise Project, and I know I'm forgetting some others that, and some that are, you know, are really just operating truly at a community level. The Lawrence Mutual Aid Network comes to mind. How do we really elevate these groups and make sure that we're doing more to provide some more upstream solutions, but also provide some low to no cost legal support to folks in areas of, you know, tenant rental eviction prevention, things like that. Or if you have had an intercept with the criminal justice system. Our third area is jobs. Our conveners there were Melissa Fisher Isaacs with the Lawrence Public Library and Anju Mishra with Housing and Credit Counseling. Priority focus area, starting off with reducing barriers to employment for BIPOC residents. You can see our objectives here and make sure that we're really focused on decreasing the BIPOC individuals experiencing discrimination in employment and increasing the number of targeted job trainings and for the BIPOC community members. Some of our strategies here are to kind of just do some baseline measurement around community experiences of discrimination. And, you know, this is the first strategy here because, I mean, it's here because it's a real thing. Our BIPOC community is, have said over and over, they feel that they are discriminated against in employment opportunities. And this is a call to action for all of us to do better. And I think that the strategies have developed through things like the Fair Chance Business Pledge, increasing access to increasing affordable and accessible job training opportunities for BIPOC community members. I know many of you may be thinking about institutions and resources like Peaslee. We're thinking about that too, and we're going to meet with them as well and try to get a better understanding of how we can increase accessibility not only to places like Peaslee, but maybe others that we're not thinking of, and imagine some alternative opportunities. And then focus on things like job retention and diverse and equitable inclusion work cultures. I know that's something that the county is just started off on, and it's a lot to wrap your brain around. But I think these are things, again, when I talk about the county should lead the way on things like parental leave. We need to lead the way in terms of making sure that we're trying to understand what we need to be, how to be a diverse, equitable, and inclusive work culture here at the county. Look at things like no to low cost personal loans for BIPOC community members is that last one there. Our next focus area, BIPOC entrepreneurship. You can see that we have a goal of increasing the number of BIPOC owned businesses in Douglas County by 5%. Strategies include increasing the BIPOC representation among the leadership in Douglas County's entrepreneurial ecosystem. Lots of work to be done here. And I say that because I've been living in a space with my friend Ryan Rains on the Douglas County e-community and the Lawrence Metro e-community, trying to better understand how those loan programs and all the other programs that are available to entrepreneurs in the community can be more accessible to our BIPOC community. Understand what are the barriers, what are the limitations that exist today, and how can we address some of those. Increase the opportunities for training and support for BIPOC entrepreneurs, and implement some no to low cost microloan programs for $50,000 or less, targeting BIPOC entrepreneurs. And that's it. That's a lot. Like I said, we have a big plan. There's a lot of detail in addition to what I shared with you. And what I would say is this is a living document. You know, we know that we're not gonna implement these strategies exactly as they're written, especially when it comes to, I'm abundantly aware of how much can I influence fines and fees. Maybe not a lot, but maybe I can't, maybe we can. And we're going to try, and we're going to have that conversation. And we're going to at least indicate that it's an area for improvement in the community, and it's a factor that's influencing poverty in the community. If you want to get involved, we would love to have more folks involved. We're moving into the operational phase of this plan. We really would love to have some folks step into the job space. We have a really great crew engaged on the early care. We have a good group of folks that are engaged on decriminalization of poverty. I would really love to have some more folks that are engaged in the work of the jobs area. I know that a lot of us are really tapped out from a bandwidth perspective, and we can be patient. We can be cognizant of folks' time, and we have great support from the health department. So I really think that that's something that we need to take advantage of and figure out a way to move forward as a community.
No doubt. Yeah, and if you have an interest in that, obviously you can reach out to me. You can reach out to Jill. You can just pop it in the chat there, and we'll reach out to you as well. Thanks, Jill. You can take a drink now, a little breather. That was great. I'm going to just briefly touch on. So you heard a lot, and you know, in the past year, there's been a lot of shift from business community and everywhere from a philanthropic standpoint toward equity causes. And and Jill, I think, did a great job of explaining the equity issues related to early care and education. What I wanted to do is touch on the economic impacts briefly and make a little bit of what the business case is here and why the chamber was actually, we were starting to dig into this a little bit pre-pandemic, because early child care and education really was in crisis mode prior to the pandemic. It's not a very sustainable model. You know, the challenges are complex and persistent. They're solvable, but we got to put resources to it, is what it really comes down to. A year of working with this group, it finally just, I gave up on all the, you know, great ideas I had of how we could help fix this, because most of them just don't work. Bottom line is the folks in the industry are not paid a fair wage. They're not paid a good wage. And that's a problem, but it's already not affordable. So how do you make people in the industry, make it more attractive to good people and deal with an already unaffordable situation? I know several on the call here know that we have an acute problem in Douglas County. Prior to the pandemic, we only have about 200 slots for infants, toddlers in our county, and we need 1,200 a year. That alone is taking people out of the workforce. What slots are available? If you're fortunate enough to get one of those, you better be making a lot of money, because they're not affordable. They're not certainly not to a majority of folks. And that's, you know, so all that's been exacerbated now by the pandemic, as there are, you know, fewer slots and more of these caregivers that are kind of going by the wayside. So it requires interventions. It's going to require innovative, diverse funding streams, and we're going to need a lot of stakeholders at the table. So this is one that I think the chamber can really step in as at least one of the co-conveners to help address this. As far as economic recovery is concerned from the pandemic, we're not going to fully recover if we don't have some interventions into our child care system here. And we're certainly not going to approach our full potential. The U.S. Chamber has identified this issue now for several years and has done some great studies pre-pandemic and some good stuff during the pandemic as well. But even pre-pandemic, they studied 4 states. It's difficult because some of what Jill pointed out during her presentation about data and the challenge of getting that data, especially in the early care and education arena, is a little challenging. But they worked in 4 states: Iowa, Idaho, Michigan, and Pennsylvania, and found that child care breakdowns are costing those economies an average of $1 billion a year. That's about $700–800 million a year in Iowa and Idaho, and over $1 billion in each of the other two states. But I think we can draw that in Kansas, we're probably similar to Iowa, Idaho in that regard. They also found that 74% of working parents in the past year have either had to stop continuing or skills education, or had their job interrupted in one form or another by childcare breakdowns. That's massive. And another statistic that I think is really striking is that the participation rate in the workforce is 75% nationally. The participation rate, so the unemployment rate might be 4%, let's say, and it is about that now, about 4.5, I think. But the unemployment rate is based on the number of people who are actively pursuing work. So you don't count children, you don't count retirees, you don't count people with disabilities that cannot be accommodated by the business community. So those folks fall out, and the remaining are, 75% of those remaining folks nationally are actually pursuing work. That means 25% of our potential workforce isn't out there pursuing a job. And the reasons are the top three. Transportation's number one. You can imagine that makes sense. If you can't get to at least wherever the opportunity is at the right time, you can't do it. Number two is childcare, and that is where we have the best opportunity to make progress. Number three is people that have disabilities that could be accommodated, but for whatever reason, they just can't find employers willing to accommodate those, and so they end up falling out of the workforce too. But as significant as that number is, 75% nationally, Kansas is 69%. Our participation rate in the workforce is fully almost 10% below the national average. That's huge. And every indication points that Douglas County is no exception in that. And when you look at our childcare shortage and the costs of, I would argue that childcare may even supplant transportation as the number one reason in our county. So it can have a significant impact. Prior to the pandemic, we were at 3% unemployment. We had employers who could grow, who could take on more business if they could find more staff. And if we could provide interventions, for instance, that created, a couple hundred additional infant toddler slots where people could go back to work. In some cases, multiple people could go into the workforce that are already here in Douglas County. We can make a huge difference. So it's worth our time and effort and energy. We see it as a two generation workforce issue. As Jill mentioned, immediate benefit is employers get more employees are more productive. But the long-term benefit, the business case, is well beyond the payback that we got for doing Peaslee Tech. Peaslee Tech, everybody recognized the importance of that and the payback to business. And the payback was in the $7 to $8 for every dollar invested, which is great. But the payback for early childhood interventions like this to the business community are more like 16 to 1. So we don't get it right early, you can't really catch up with it later. But right now you get the benefits of your current employees, more of them being at work, and those people being more productive. And then down the road, the benefits are even greater. So we're early in forming coalitions and getting to hitting the ground on this work. But this has been a great week in that we did put together a budget ask for the first time in, I think, our city's history. Steve Kelly and Ryan Raines, Bonnie Lowe here at the Chamber have been working very close with the city on the Economic Development Strategic Plan. And as a part of that, they've been making sure to inject that, in fact, childcare, we see that as being a very important driver moving forward. And so the city asked about, a formal budget ask with their economic development funds. We presented with Childcare Aware and Positive Bright Start to the city and requested about $1 million to the PERC committee, that's the Public Incentives Review Committee, earlier this week. $600,000 about for childcare scholarships, about $200,000 to retrofit a facility, specifically Kennedy Elementary School, to accommodate childcare in that facility, and another couple $100,000 to help with the ecosystem to support and to incentivize new people to come into the field, especially in the home-based care, so that we can ramp up, scale up the slots available. PERC recommended those for approval. So they will go to the city commission next, and we'll be brushing up and hopefully improving on our presentation. But that was a big step. And then that same evening, the school board, as you know, voted to approve to convert Kennedy to early care facility, and toured with the school district. Dr. Lewis set up, we took a bus and took school district leadership and also toured Operation Breakthrough just days before that meeting. They're very excited about the possibilities of doing something kind of similar to what we did at Peaslee Tech. The bricks and mortar are provided, which really helps to reduce costs for providers. And then we're looking to bring in multiple providers to do not just early care, but wraparound services to support those working parents as well. So we're real excited about that.